Before I start today's presentation, I want to pay my respects to traditional owners of the lands that we're meeting on, the Gunai Kurnai, or variations thereof have been described previously. But so pay those respects and respects to all elders, past and present, who may be with us today. And to introduce Simone Bell, who's taken on the role of manager of the RTO operations at Vaccho. So Simone has come to us with a really strong background in children's services, HAC, aged care and so on, and particularly delivering that to Aboriginal students over many years. And from another RTO perspective, she brings into our unit some great supervisory and dynamic energy. So we're looking to see Vaccho's training unit just get up and run again over the next few years. And this is what the energy that Simone brings to help us do that. So Simone doesn't wish to speak, she's pushing the buttons. Anyway, I've been at Vaccho for about 7 or 8 years, and one of my very earliest experiences was to come down to Orbost to meet with the G'lai Nalu group for a day meeting or a half-day meeting. And so I've known about G'lai Nalu and how dynamic it is in this region for some time. So I'm really excited to be here today. Click. So I got this list that was in the program about what I'm to talk about today, and I don't know, it seems like such an enormous task to talk about the emerging trends and issues in Aboriginal health, in the Aboriginal health space, the need for ongoing training and PD for Aboriginal health workers, changes to legislation in the health sector.
You mean personal development?
Yeah, professional development, I apologise. And ways to manage the impact of change and implementing change to improve workforce productivity. And when I read that last night, because that's when I started on this, I thought, OMG, oh my God, it's like I'm going to present a master's thesis or something. But I brought it back down to a realistic level, and I hope to be able to talk about things that people are doing and how real Vaccho's involvement is in Aboriginal health and Aboriginal health education and training. So a little bit about our RTO and education and training in general. It is a vital link between health and economic wellbeing. Vaccho is a strong Aboriginal-owned and controlled registered training organisation. 98% of our students identify as being of Aboriginal and Torres Strait Islander descent. Our student outcomes compare very favourably with national statistics. So my involvement with the RTO is based on I believe that top line. I believe that education and training is transformational for people and opens up doors and opens up self-awareness. So I hope that, if you've been involved with us or going to get involved with us, you experience that as well. Here are some of our graduates, taken it, from a couple of years ago. But, a lot of those students were from the ATO, employed in the ATO sector. And, we used to celebrate with a big whiz-bang graduation ceremony, but things have changed in registration requirements. We've got to get the certificates out a bit quicker, and so we're more inclined to go to workplaces to present them, but happy students. And that was in our new building just after the opening in Sackville Street, Collingwood. So more about us. Our specialisations are in Aboriginal and Torres Strait Islander primary health care, and we've got a range of national qualifications from Certificate 2, Certificate 3 and Certificate 4, 2 streams there, and a diploma on our scope of registration. We also deliver the Cert for Population Health, which is based on health promotion, and a number of Aboriginal health workers really work in that health promotion space. It's quite relevant to, the tobacco action workers, healthy lifestyle workers and those types of workers out in the Aboriginal health workforce. We've got home and community care on our scope. We are going to broaden out to aged care and some of the children's services qualifications and plus disability. We have a diploma of counselling on our scope, and there's a lot of interest, and a group of students currently finishing who commenced in 2014 and going really well in that program. It has a lot of uptake, and there's a lot of genuine interest by Aboriginal health workers who be functioning in the field for a time to broaden out into enhancing their counselling skills. We're also looking at, in relation to that program, to setting up pathways with Australian Catholic University to gain advanced standing or crediting to some of their degree programs that are relevant to and use those skills and the insights learned in the counselling program. We also had business administration, human resources and management and frontline management, and the diploma of practice management on our scope as well. This year we're actually doing a major program in collaboration with another unit in the RTR and in the broader Vaccho. We're actually doing a major capacity building project, and it focuses on the delivery of the Certificate for Human Resources, and that's funded by the Department of Health to develop the human resources capability or human resource management capability of the ACHO sector. So I think there are about 14 students from around the state participating in that program, and we launched that this week. So the other thing is, this is a vital. I feel within our unit that we've got a very strong commitment to supporting our students towards their completion and their success with our training programs. What we're doing currently is a little bit innovative and a bit exciting for us. Whilst we've mainly focused on workforce development, that is people who are currently in employment and giving them recognition for where they might have been employed as a health worker for a long time, or they're just recently employed, getting them, the qualifications they need to perform their job. But what we're doing now, and we commenced it a couple of years ago, is pre-employment programs, because there are numerous people within the community who've not had access or not felt they've had access to training opportunities, and the link between, getting a kickstart on a training opportunity and employment outcomes is pretty strong. So we're focusing pretty strongly on that this year. A couple of years ago we did work with a small group at Portland. Last year we worked with another large group of younger students who weren't attending secondary college any longer up at Shepparton, and there were about 12, and 3 of those have come out with a job at the end. Amazing. So on our way here today, we dropped off at Maui because we've been working with the Lens at Trafalgar and West Gippsland Healthcare Group, and putting together a program based on the Certificate in Aboriginal Health Work for young people from community there. And they signed the enrolment forms yesterday. They're going to be working on a special program called The Drumbeat with Cindy Mathers, I don't know if she's known here or not, to orientate them to returning to study and getting in touch with themselves. And then we'll commence the delivery of the certificate too over, about 8 or 9 months. So we're happy to do that. To get these things together, we thrive on creating local partnerships. And an example at Maui is there's an adult community and further education provider called Guest. They're becoming involved with it to provide mentoring and support to the students. We're involved with West Gippsland Community Health Group, and we're utilising some of their staff to deliver the training. One person who's involved in that training is a graduate of our Certificate in Aboriginal Health Worker, the practice stream, and the other is one of their community nurses who has this great interest in education as well. So it's a great partnership, and the Lens, their local learning education network, is helping us form the relationships to provide the facilities and creating linkages for us to talk to people at Guest and so on. So it's a great example of local partnerships. The successful outcome is something that drives us, particularly based on that example at Shepparton, where one person got a job with the ACHO, another got a job with the local drug recovery centre, another got work as, what was it, Simone? I think.
The aged care facility?
The aged care facility, that's right. There is one other that I know of, I just can't pull it out of my head right at the minute. But that's not bad out of 12 students, for those. And the upshot of it is for those who weren't successful, we're going back this year and they will be able to go up to the next level of qualification if they like. So, yeah, I'm going to talk a little bit more about that sort of process a little bit later. And the other part of what we do is, as I mentioned, is upskilling the existing Aboriginal health workers through the training programs we have. Sometimes they're employed in the ACHOs, but we do find that the ACHOs, it's known they have great relationships or good relationships with mainstream health providers, and sometimes they employ Aboriginal people in health roles. So the training funding in Victoria is very generous. It's not like the old days where you got 10 places and that's all the money you had to spend on training. If you meet the criteria, the door is open to you to come and do training. I'm getting a glass of water. Okay. Go back. Now I've done a spiel on the RTO, but I'll go back to it again a bit later. This is some of the serious sort of stuff that was embedded in the program, and I'm not an expert.
Have a drink, Carol. No, I will. Yeah, I will say something. Yeah. Okay. Cool. I'm just giving a background as well. God, I've been training. I can talk and talk and talk. So my background is education, but I actually started off as a trainee myself. So I come from, my brother was an extreme academic and I certainly wasn't. So I started off as a trainee in children's services and I worked my way up. I put myself through college, paid for it myself, yada yada, and worked my way up to then becoming a director and then managing centres. And then I went into supporting children with additional needs, so really looking at autism, Down syndrome, the blind. And then I headed off to England for a 2-year stint and worked in a Montessori school, so it's just a different method of teaching again. Then I came back and I had an RTO approach me, and they'd heard on the grapevine that I was this type of person that liked to be thrown in the deep end, so to speak, with a challenge. So hence any challenging behaviours, anything that I see as a challenge, I love to have a crack at it. So they found me, and it was the role was delivering adult education to adult Indigenous. So it was predominantly children's services qualifications and aged care qualifications to all the areas, remote areas, communities across Australia. So I did a lot of travelling and got to know a lot of communities, and I loved it dearly. I just got absolutely burnt out after 4 years. Had some great outcomes with students and saw them going on to bigger and better things. So nursing, university degrees, teaching, masters, some of them, they're just phenomenal. Yeah, crazy. Then I I actually moved from Queensland. I was up living in Queensland, so then I moved to Melbourne and went into another RTO because my students used to say to me, why didn't I have a fella? And I said to her, well, it's because I love you guys and you are my family, and I decided that I needed to probably get a little bit more stability. So I actually moved to Melbourne for a new job and working in a mainstream RTO. Which again I loved, and I brought a lot of the experiences that I'd had previously. You know, we worked with a lot of students from long-term unemployed and stuff like that, so I did a lot of support services there and looked after a lot of campus and the student outcomes and whatnot. After 4 years there, I knew where my passion's always been with Indigenous training and education, and it will remain that way. So hence now I'm at Vaccho. As soon as I saw this opportunity, I jumped at it. So it's just feel like I'm home again. And I think from someone that's had a little bit of varied experiences with RTOs, it's really important that we have facilitators, we have trainers that of course are not only passionate people and of course have the qualifications to deliver these to the students, but can think outside the square. So getting back to my comment that I wasn't an academic at school by any means, and back then, you know, teachers really worked alongside a curriculum, and if you were outside of that curriculum, tough luck, you sort of didn't fit into the norm. And I was one of those kids that my mum and dad put me into a, you know, maths tutor on a Thursday afternoon, and I used to go around to the teacher's house, and he used to have this tiny little caravan outside his house. And it was terribly intimidating, not to mention this is the same maths teacher that my brother had, so he had high hopes for me and I certainly didn't live up to them. So I'd sit in this little caravan and he'd sit there and I could see how frustrated he was getting that I just couldn't get it. And I actually felt more sorry for him than I did for myself, because I'm like, you poor bugger. He's like, okay, let's talk about apples and oranges. And I'm like, huh? So I think that for me started to instill some left field thinking, I suppose. My mother's an artist and a nurse, and I probably have more of a creative side. So I started to, think about delivery and how people cope with not the mainstream way. And, I'm a very practical, task-orientated person, so someone needs to really transfer information theory into a practical aspect that I can understand, This is what I'm talking about. So if you're sitting with the children, or if you're sitting with the elderly, or you're sitting in a health organisation, paint a picture, give me a visual picture, and I'm there. And I think that that's something that is so important, that if the students aren't getting something, it's the responsibility of the trainer or the teacher at school, and that they need to then figure out some strategies and new visions to get through to that student. And that's why I love Vaccho. I think they're really on board with that. Hence Carol just mentioning about the Maui drum beats. So again, having this 4-week of, really building communication skills and team skills through drum beats that Cindy does. She's just amazing. That really creates that trust environment, so you can break down some barriers of learning straight away with the group, and get them talking and really exploring each other and pathways for them. So that's a little bit about me. I won't talk anymore. Carol's probably had a good break now.
Oh, good.
But yeah. And I'm very happy to be here and love to have a chat with you later on.
Cool. I'm glad you did that. Thanks. She's shy. Anyways. Look, my view of Aboriginal health workers is that they're not blinkered to what's going on out in the world there in the political domain in any way, sense or form. And so this is a very minor snapshot of where Vaccho's at in terms of the emerging trends. And just recently we've had, the Abbott government come in and he's moved Aboriginal health and Aboriginal affairs into his portfolio in the Department of Prime Minister and Cabinet.
Someone from Britain.
And all sorts of stuff. What that means to us, and it has had an impact on the RTO, because we had a funding contract with DEWA that then moved into the Department of Prime Minister and Cabinet, and then they opened up a whole new tendering process for funding under the Indigenous Advantage Strategy. And I think they had consultations and all this whole set of forms and processes coming out. Then you had to unpack what the briefing was for that funding. And it was like, I think that means that was that funding we used to get for that, and that was that funding we for that. And they jumped and threw it all in a bucket, give it a good shake, and if you could make sense out of it, I'd go, hey. But anyway, so the upshot of it is, they ended up getting over 3,000 submissions, and they couldn't work out how they were going to sort them out and notify you when the funding was going to be granted. So it changes the government reporting requirements, the creation of some uncertainty for Vaccho, and that IAS funding is one example, on locating the pathways to funding to support the innovative solutions that Vaccho comes up with for community health. So, that was that change. And then again, in the state domain, we see that the Labor Party's come back into government. They've merged the Department of Health and Department of Human Services. My view is, I think that's going to open up a lot of possibilities for Vaccho to source funding that was once siloed off. And now, certainly some of the things that DHS were dealing with are related to things that the Department of Health were dealing with, particularly in the Aboriginal health space. So that's a positive, I think. But once they get who's who in the zoo settled, we'll be talking to them harder and across more broader issues. And I probably think that's going to filter down to the ACHO sector, at that level as well. In terms of in Victoria, my experience in the Aboriginal and Torres Strait Islander Health RTO National Network, which is a grouping of Aboriginal RTOs just like ours, situated all around Australia. When I had a look at how they have to struggle to get funding from the state government, I thought we've got a fantastic system in Victoria under the Victorian Training Guarantee. The weak points in it are that there are some RTOs who are very unscrupulous, who will rort the system, enrol people and they haven't told what they're enrolling in, do the claims, look at them and tell them you've been trained, we're going to get your money, get the money off the government there. Sometimes that happens, but we're pretty rigid on that. But the upshot of that training system funding is that it's open. If you meet the criteria, you have a right to source that funding, and it goes through the RTO. So it removes privilege from sourcing training and development and puts it back into your domain as being a right to access that. The other things are, of course, the professionalisation of Aboriginal health workers through, it's probably out of sequence there, the registration with AHPRA, for certain people who've got certain practice, and now the development of a national scope of practice, which brings the Aboriginal health worker right in line with every other health profession that exists.
So what's AHPRA?
Australian Health Professional Registration Authority or Association, something like that. I think that's it. So if you achieve a certificate in Aboriginal health work in the practice stream, you register with them, and then that gives you some capabilities around, making Medicare claims for your service when you're providing that service. But it's also the focus of that type of professional registration is to provide protection for consumers, so that you acknowledge you are skilled and your skills are recognised to the level you can deliver a quality service. So psychologists, doctors of Chinese medicine, nurses, some of the allied health professions, etc., they have this registration process.
But also recognises Aboriginal health workers, not just Aboriginal health workers, but as practitioners.
Aboriginal health practitioners.
Yeah. So
It's significant.
there's a career.
There is, and it's acknowledged. Vaccho started talking about that process, I reckon, about 5 or 6 years ago, and it's sort of, the understanding and acceptance of it as a process by the Aboriginal health workers around the state as acknowledging it now as, it has a value. I think in Victoria we've probably got about 11 or 12 maybe who have registered, but we're expecting out of the current group of students doing the Cert 4 practice that, we'll have a fair, out of 20 or so, I think we'll have some significant number or percentage of those will gain the full qualification, will be able to register. And we're promoting it more to our students as well.
Really, really, really helpful and really good for our mob in our health services to have registered practitioners.
Absolutely.
Everything that the doctor and the nurses used to do, now Aboriginal health workers can be trained up to do those things, like taking the bloods and
Medications.
so
You can include more in the scope of office of what you're doing for that training, is that right?
Yeah.
So if you wanted to go into like natural medicine, it's not just like say bloods and things like that. You could go into that field and get accredited for that, is that right?
I'm not sure if there are registrations required around that, but certainly within the Aboriginal health worker qualifications, they always do recognise, traditional medicine practice. Yeah. And I've got very limited knowledge of that. Tammy Chatfield, who's in our staff, and she is a doctor of Chinese medicine and is very well aware of complementary and non-Western models of healthcare, is much more au fait with that. I'd be happy to point you in her direction if you wanted to discuss it.
Tammy Chatfield.
Yeah, Tammy Chatfield. Alright,
With if people have registered after doing a Cert 4 workers practitioner, so those skills would be much similar to that of a Div 2 nurse.
Yeah.
So are those skills then recognised if they want to go and do their Div 1 at uni?
Yeah, they have to enter university under what's termed the Australian Qualifications Framework, which is a documented policy that says at this level you're entitled to that much credit into a degree, and at that level you're entitled to that much credit into a degree program. So
It can vary from university
It
to
does,
university,
yeah.
so I
There
would
will be RPLs for some
absolutely
Exactly.
credits, yeah. But I would always advise any students that ask me that question is let's ring the university first, because they will differ. So I would never want somebody to go, you told me that. Sorry.
no, but
Yeah.
but it is documented, and we are establishing relationships with the university sectors, Australian Catholic University and Ike and Deakin in particular. And in my last conversations at Ike just before Christmas, they come to learn what we were in our curriculum and what the Aboriginal health worker was being taught, and they were just amazed at the quality of the knowledge and that we're passing on. So, but it does, you know, I think under the Australian quality frame, you know, the registration requirements and the tertiary education requirements, you know, they are required to, you know, it is documented, you're supposed to get so much credit, but how they actually implement that's another matter. But I think it's the quality of our delivery and the quality of the relationship that we strike with the universities as individual providers will, you know, lend itself to the appropriate levels of recognition. Yeah. You're right.
That's huge.
Okay, we'll talk about ongoing training and professional development for our Aboriginal health workers. Some people might say why. I don't know which ones, but they probably sort of say why. But I'd be inclined to say why not. And I'll see why anyone that's. And I don't know what you feel around about this. It's the audience. You want, if you're a health worker, you want ongoing professional development opportunities for training. A number of reasons that. What some of those things that you could undertake is that, you know, different skill sets that lend itself to specialisation, such as in ear health, eye health, nutrition, dual diagnosis. There are a whole range of other skill sets that are packaged and recognised as skill sets. But any other competencies that you achieve on top of your full qualification is enhancing your capability. You could do this also through, you know, topping up and refreshing with some other non-accredited short courses, for example, and or, you know, undertaking first aid, making sure you get that refreshed on the annual or biannual basis to maintain your currency for registration purposes. You can undertake ongoing PD and training to help you progress upwards with higher level qualifications, and sometimes that can take you into management skills. There's a bit of a divide in vocational education and training. Once you get to diploma level, you can take two pathways. You can take a paraprofessional pathway, which, you know, say in health work, would give you higher level clinical skills, or you can go down the pathway of management type, supervisory type skills. And that's how the AQF divides that. The Aboriginal health worker quals at diploma level have a very healthy mix of those. In some sense, they kind of stepped away from higher level clinical skills and took more of the supervisory vein, but still I think if you compare the Aboriginal health worker quals to, say, the Div 2 nursing, I think the Aboriginal health worker qual at Cert 4 is just about the same as the diploma health nursing qual. But that's an argument for someone else. You can use ongoing training for professional development to, you know, take a career change, go in another direction. And or you can use ongoing training with PE to gain employment as well. There is, I was doing a bit of research last night and looked about, you know, workforce planning and other things that's available via Google, and some of it was Australian based and some of it was Department of Health, Western Australia and so on. But there is a direct relationship between higher level qualifications and employment and or career progression. So once you start with Cert 3, you start moving up the Cert, you know, say someone with it coming out with a Cert 4 and or a diploma, your career progression and or if you're not employed, your employment opportunities increase. And so sometimes there's a wage, sometimes. My observation over a long period of time that really kicked in for me, I walked down to Tasmania. We've been working with a social emotional wellbeing workforce in Victoria, and it was a nationally funded program and delivered all around. But once I started to hear the health workers talk about their experience and what that training had meant to them, and the underlying thread was their outcomes were focused on that they'd go back to their community and help their communities as the outcome of their training and their new learning and new skills. And so I just started to think, really, I think an Aboriginal health worker is a bit more than an Aboriginal health worker. I reckon they become change agents, and that takes us into a bit of a discussion around change. I'll have a sip. If I'm talking too much, you can tell me. Change is a bit of an interest for me because before I jumped on board at Vaccho as a fully fledged employee, I was acting I'd been seconded from another organisation in Melbourne, and I conducted a review of the RTO, and then I went on to implement the report that I developed as a part of that review, and I was employed as a change manager. And the idea was I was supposed to get things up and running. And so I started to think about, change, really, what it means. And on the way down, I said to Simone, I've got to do this, and I can't remember my notes on that. And she Googled a range of quotes by significant others around change, and I siphoned them off a bit last night. So I thought some are appropriate, some are not. So here we go, about what change is, or how other people see change and what it can do and what it's supposed to be. And change will not come if we wait for some other person or time. Mr. Obama told us that. People don't resist change. They resist being changed. And that says something about ownership. If you take people with you, change will occur. But if you say, you stand over and say, you have to change. There's limited times when you need to do or could do that. If you take them with you, it will occur. Or if it comes from within individuals, it will occur. Peter Seng wrote that. I'm from the white fella's world of management. Sorry about that. He wrote a book called The Fifth Discipline. Probably no news to anybody, or nobody cares, but for my previous study life, it was a big deal for a while. But there's some truths in it. Change has a bad reputation. It isn't all bad. Change is necessary to keep us moving, growing, and interested. And life without change would be static and boring and dull. And I don't know who Dr. Dio Grady is, but it's probably, that resonates with me, that it does mean those things. If you think about an Aboriginal health worker, they came into existence because they didn't like the status quo and they don't like what's happening out there, and they want to change what's going on. So, this Sean Ewan is an associate professor at Melbourne Uni, and I actually met him in my very early days with Vaccho, a young chap very interested in Aboriginal health, and here he has, he's progressed to become an associate professor, and he was sort of doing some collaborative work within Vaccho or somewhere around that, and actually come across this quote from him. To make real long-term gains, we, and I'm saying this probably a management community, we need leadership from highly skilled, well-qualified Indigenous people who are able to mobilise action and build an agenda for change in their areas of health practice. And I think that's what the link is between professional development, ongoing training and change. And it's relevant to Aboriginal health workers.
Can I just add something?
Yeah, sure.
Just on change, and I've heard a few of our own leaders in our own communities, in health, and especially some of the elders that have, worked towards change for better health in Aboriginal. They say that, we're always constantly dealing with the change, the change in governments and all that, that we hardly get time to actually do the work that we're, getting skilled up in, and then a change will come, adapt. So we're really adaptable people as Aboriginal people. So, you know, but change, you know, can be a good thing if we're doing it together. And if we're all networking and all, you know, able to help each other and work with each other, you know, change can be a good thing. But, you know, we're always dealing with change, and that's like one good strong aspect to Aboriginal communities. They're very adaptable and will get up and keep going, you know, so.
That's right.
So, I mean, like you said, leading, when you know, saying we're all going to do it together, good change can happen. But if you're leading out too far and saying, you've got to do this, you know, you probably stand up there by yourself.
That's right. And the other thing I was trying to get, and well, put across that I probably need to say in real plain language is, for me to stand up here and talk to Aboriginal health workers about change and what good it is, it's like telling you to suck eggs. Because I think you know what it's about, because it's the impetus behind the existence, the emergence of the role. So, a little bit of information that came out recently when we were making submissions from Vaccho to the Twiggy Forest Review, was that we put forward the argument that the ACCHO sector is the highest employer of Aboriginal people, and usually take them straight from community and give them a chance in the workforce, and no other organisation kind of does that. And so we were trying to use that to leverage and make a shift in how the Twiggy Forest report was taken, to put some focus back on the ACCHO sector for what they actually do. And it can be seen as like it's a grassroots effort to effect change and maintain commitment to improving Aboriginal health and wellbeing towards, you know, to say, close the gap. And that's where those words come from, but it's acknowledging what the ACCHO sector does, and it's not often funded directly to do that. It does it because it does it. The other thing that related to that is that, you know, changing and workforce development and all that is, since 2007, if I refer back to that photo, I know students who've come in at Cert 3 and are now doing a diploma. And when they started off with the Cert 3, they were thinking, oh, this was amazing, I don't know if I'm going to finish it, but here they are, come back and having another go, continuing to have a go and step up. So we are seeing more come back to us and seeing them get higher levels and then taking those skills back home. So it's pretty good. So change for the workforce is, when I refer back to, you know, we get a shepherding for those students coming in, falling out of the secondary system, not much hope or feeling of where they could fit into the world, and, you know, getting some outcomes in employment and then feeling like they can come back and maybe, if they haven't got a job, have another go. We organise placements for them and so on. So a really good thing, and that's workforce development and that's workforce change. We're looking for the similar types of outcomes at Maui with what we're going to commence doing there, and we're happy to use that as a whole new focus for our RTO to go around wherever, you know, there's interest and we think we can meet that need. In essence, the health and the community services industry is looking for workers in all areas. We have a lot of community members who are looking for work. We ought to be putting it all together and something ought to happen. So at some levels, entry-level skills are the key. Okay? Getting a foot in the door, some level of skill to get you started to getting employed. Actually, so that's the basis of the configuration of the course we're delivering at Maui. We're putting in there some safe food handling. We're talking about the broader health industry, talking about Aboriginal health work. But we're going to, and there's some computer skills and some workplace communication. But we're saying, you know, sometimes you're in a health worker qualification, but you might not really necessarily want to be involved with people doing physical health checks and that type of thing. It's not everyone's cup of tea. And so, but those other skills give you some other options for other parts of a health organisation. So that's the
Give an
rationale.
example. Sorry.
Yeah, you guys, no, I don't mind.
Of an Aboriginal girl that works in traineeship, and she's doing the administration side of things. And I was telling her about this gathering, and and I said, you might be interested in. She loves working with the mob, and she loves being in touch and having that talk, in the administration part. But she doesn't want to do the health worker stuff because she doesn't like the medical side.
That's
But so. But I thought, it's still, you can get an idea of what's out there and how to work in a hospital in that area of admin. So, yeah.
When the students get an opportunity to do placement too, it gives that broader view of really seeing what goes on in whether it be a hospital or an aged care facility, or they can see that I really don't need to do that. I could do this, and it starts really broadening their knowledge and understanding of where it could lead them.
So change for the workforce. A case in point is that whole training process sparks a change in us as participants in that. Come out with new skills, new ideas, new ways of doing things, new ways of seeing things, and new ways of seeing ourselves. I think that's, there's a strong element of heightened self-awareness, getting more to know yourself, and it might be, knowing that I don't like doing that, but knowing that I've got some pretty good ideas, and others in the group thought it was good, and the teacher thought it was good, so it can sort of validate the sense of self and help grow a bit. The managing change, and this comes as more of a question than a solution, I think, because a case in point, managing change in the workforce, and this is what I mean, is it becomes a question, this part of the chat. The Diploma of Aboriginal and Torres Strait Islander primary healthcare comprises competencies that include managing staff, meetings, managing budgets, managing the organisation of workplace health and safety. It talks about being able to work with the social and emotional well-being of staff and clients. It talks about there are competencies around working strategically in Aboriginal health and advocating for the community, conducting research and focusing on reflective practice. So it's a dynamite qualification, and I just think, thanks. There is no other vocational education and training health qualification quite as dynamic as this one. It gives a more powerful outcome than the Div 2 nursing qualification, because I don't think you talk about strategy and working strategically as a Div 2 nurse. And I'm not downgrading being a Div 2 nurse, but to me, when I started reading those competencies, I'm thinking, my God, this Aboriginal health is going to come up with a bit of a cert and some strong clinical skills, but this other way of working that is going to be amazing. So what I want to know is, this is the question, how do these graduates, when they finish a diploma with all of those competencies, impact on their workplaces, particularly the actuarial sector and the mainstream organisations that they're going to partner with, because they're going to be so confident, able to communicate, strategically, to barter and negotiate with the other health services around, and they're going to be geared up with a lot of relevant knowledge, because they're going to conduct this amazing research of what is the community needs here, how we're going to get our clients and our community access to the appropriate health services that they need. So they're going to be a strong advocate. So the impact of these workers, and there's still a question, because I'm going to be amazed to see how they're going to fit in and how they're going to work out there. They're going to come out on the front foot. And so if you were a supervisor in HR, how would these skilled workers affect how things are done in the local scene? What types of relationships will need to evolve in the existing management structure to give the acknowledgement to this individual who's so geared and so positive and so proactive? And what bridges are going to be built between the mainstream service providers and the community as a result of these newly charged change agents?
So I don't have the answers, but I reckon it's going to be a great challenge. I don't know what to say next. This is one of the things I was supposed to say in the middle, and I have to say up front, I'm not strong in this area. I've been to a forum on the Mental Health Act, but I can't give you the nuts and bolts. Only to let you know that there are some changes to the Mental Health Act, and think there are some treatments that were previously very taboo are much more acceptable now with changes to how those are done and accepted. But I'm not a clinician. The other changes are there's some changes to Medicare claiming numbers for the Aboriginal health workers, and that you might need to be an Aboriginal health practitioner for some of the skills and services you provide to enable claiming to take place. So there is further information available, and I can tell that, you know, there is some knowledge in the room about that. I'm not the doyen or the hub of knowledge to give you definitive responses to any of that, but those are some of the changes that are there. I think that's it. I hope I didn't go on too long. Thank you.